Hey, I'm Jillian Dean, and today we will look at several disorders and talk about how they affect an individual's life, the possible treatments, and how they may help a client with these disorders. The first disorder we are going to look at are eating disorders. There seems to be two different types of eating disorders in the videos, and they are classified as anorexia and bulimia. When individuals were asked, or the family members were asked, they all agreed that these disorders are ones that the person carries with them all the days of their life, and it is a severe mental disorder. Anorexia is considered one of the most harmful mental disorders, and not only psychologically but physically as well. While anorexia nervosa and bulimia nervosa are described as following similar patterns of overvaluing thoughts or behaviors on weight, those with anorexia are usually underweight, and they come up with new ways to lose weight. They have a distorted perception of their body and their mind, and their BMI is usually under 17.5. They will restrict themselves over exercise, and once they get compliments or praise, no amount of weight is enough for them to lose. If this behavior continues, over time, they can see issues with fatigue, infertility, heart issues, and compulsive behaviors. Bulimia nervosa is when the client binge eats and has no to little control. That's followed by a large amount of shame and guilt or disgust. If they begin to purge, over time they could experience electrolyte issues, kidney issues, dental issues, changes in hormones, and stomach issues. Clients who show signs of bulimia can also abuse laxatives. The videos stated that bulimia can be linked to self-esteem and being alone, and resembles various traits of borderline personality disorder, specifically impulsivity. Bulimia must have weekly symptoms or traits that last longer than 3 months. The videos we watched emphasized that cognitive behavioral therapy could be used as treatment for both anorexia and bulimia. While 10 to 20% of those may still have disordered eating habits, about 1/3 of them will have partial recovery. The video showed that those who had a diagnosis and were part of residential care showed the most improvement. This treatment allows the client to be around people struggling with the same disorder, but not being in isolation. They learn healthy habits and build relationships, which can give them life skills to carry once they're outside of residential care and network and community even. The studies showed that those with residential care saw major improvements, but the opportunities for this were limited and typically offered in America. The second disorder is somatic symptom disorder. And this is when a person has a significant focus on physical symptoms, such as like pain, distress, weakness or shortness of breath, and it causes problems functioning. The client must fit the criteria that they have excessive thoughts or feelings surrounding this distress, and there's an excessive amount of time and energy devoted to the symptoms or to the health concerns. All of this must exhibit symptoms or issues for at least 6 months. Clients diagnosed with this will have other medical issues ruled out, and while the cause is truly unknown, it could be attached to like anxiety, genetics, or trauma. The treatment that is recommended is CBT, and this is incredibly helpful to the client because it allows them to reconnect or realign their mind and body in a healthy state. The third disorder is conversion disorder. This is described as a functional neurological disorder. No other medical diagnosis holds to this diagnosis, so they are recognized as a physiological cause, or it's recognized as a physiological cause, excuse me. The client will have pseudo seizures in which they will still be conscious or awake, where usually during a seizure, consciousness turns off. Those with conversion disorder can experience 8 different types: weakness or paralysis, abnormal movements like tremors, stiffness, walking problems, swallowing symptoms, their throat closing, speech symptoms, attacks or seizures, sensory loss, special sensory symptoms, or mixed symptoms. And treatment that is recommended is CBT. This allows the client to attach their thoughts, feelings, and actions to be able to understand their thought patterns and eventually see improvement in their disorder. Elimination disorder is where clients exhibit enuresis and urinating on oneself at least once a day, or encopresis, having bowel movements on oneself. Criteria A for this diagnosis would be repeated urination or bowel movement once a day on themselves, and criteria B, it must happen at least twice a week. Criteria C is that the client must be at least 5 years old, and it has to happen over a 3-month period. Criteria D is that this is not a side effect of a medication or another medical diagnosis like diabetes. If the client has a condition called neurogenic bladder, which is caused by the nervous system, then this would eliminate elimination disorder, because their peripheral nerves are damaged and they have difficulty emptying, or the nerves in their spinal cord and brain are damaged, and so eliminate this diagnosis. Elimination disorder can occur nocturnally or during the day, and this is caused usually by stressors. The video recommends that the caretaker or the guardian should not yell. There should be no physical punishment or no negative words, but in fact we want to be like very matter of fact. The treatment also would be like depression medication, or even medication to lessen the frequency of urination. And once the client is able to experience positive behavior or have control over their body, it may allow them to move into a space where they aren't exhibiting this behavior like they were before. I would recommend psychotherapy to make sure there isn't a fear or another stressor or trauma at play. The final disorders we will talk about today are sleep disorders. Insomnia, restless leg syndrome, narcolepsy, obstructive sleep apnea, circadian rhythm disorders, and REM sleep behavior disorder, and sleep paralysis, Insomnia is defined as difficulty sleeping, waking up earlier, or falling asleep, or waking up in the middle of the night. Insomnia can be the beginning of distress or disability if it continues. It can cause moodiness or worry. If lifestyle drugs are the cause of this, then this would be exempt. But about 40% of people with insomnia have another mental disorder. Physical health support, mental and pain management is all affected by this. Those that battle with insomnia have a higher accident rate than most and have a higher mortality rate, 5 times the amount, because they act as if they were under the influence of something. Treatment for insomnia is CBT or CBTI, hypnotics, Z-drugs, and Benadryl. If the client develops a tolerance to sedatives over time, it can create issues with falling asleep. This will allow their brain and body to rest, allowing their body to restore and heal. So sleep is crucial for functioning cognitively, as well as repairing organs and restoring hormones properly. Obstructive sleep apnea is a condition in which they suffer from breathing issues due to a blocking of anatomical of the airways, and this is usually caused by like muscle relaxation in the night. Results in sleep is not restorative, so the patient or the client will have headaches, and they have bedtime insomnia. Clients can see relief in a CPAP machine or exercise, but like the video stated, this is usually an underlying cause of another medical diagnosis. Another sleep disorder is restless leg syndrome, and we can define that with urge. There is to move their legs, so urge to move. Rest worsens the condition. It gets better with activity, and the evening is worse. The culprit is usually iron deficiency or other mental disorders. Treatment can be implementing supplements or medications, and when this is treated properly, the body is able to hit those sleep cycles and wake up feeling rested so they can exercise, eat well, and take care of their body. Circadian rhythm disorder is where the client is awake at night and sleepy throughout the day. Treatment can be melatonin or exposure to bright light or getting outside and getting natural vitamin D, or there could be medication to promote wakefulness. With sleepwalking, there is no clear cause, and so I'm not sure of a treatment. But with nighttime disorder, it's usually where a child is waking up distressed, and reassurance is usually sufficient enough for the treatment. There's also sleep paralysis. This is terrifying and can cause anxiety or issues avoiding sleep, so CBT and SSRIs can be used for treatment. Then there is REM sleep behavior disorder. This is where the client moves during REM sleep and they remember their dreams. This can be an underlying symptom in Parkinson's or dementia, and this is where the client actually outs out their dreams, and they can hurt their partners. Melatonin is recommended for treatment. Narcolepsy is a neurological disorder, and it causes daytime sleepiness. CHAP is the acronym used to diagnose, since it's cataplexy and sudden episodes of muscle paralysis or strong emotional states, not sometimes, hypnagogic hallucinations. They're groggy at night in sessions of sleep, hypnopompic hallucinations, where it's like you get yourself up going in the morning, and the narcolepsy of the abnormalities in REM sleep. There's the attacks where there's strong episodes of falling asleep even though they don't mean to, and P is for sleep paralysis. Those with narcolepsy are remembering their dreams and remaining still after the patient wakes up. With all of these sleep disorders, sleep hygiene, routines of eating well, exercise, and avoidance of alcohol and caffeine may help see the condition improve. In the video, the acronym LAID is given to remind us for lifestyle changes, so no drugs, caffeine, stimulants. A for anticonvulsants. I is for iron supplementation, and D is for dopamine agonists. These are used less and less in the psychological world. But those are our sleep disorders and our other eating disorders. And so we hope that the client sees improvement in their disorders, but especially when the ones with sleep cycles, it's going to help with their relationships, their moods, and their day-to-day life. So thank you so much, and I hope that you have a good day. Bye.